Dear parents, as you all know, I'm Dr. Himani Khanna. I am a developmental pediatrician, a co-founder and director at Continue Kids. We are making this video to help our parents with the guidelines on immunization and their routine pediatric visits, the precautions that they need to take when they visit their pediatrician, and what all they need to keep in mind when they are taking their child for a immunization or a vaccination visit during this times of pandemic. So we have with us again very eminent pediatrician from Delhi, Dr. Parvinder Singh Narang, who's going to guide us on the precautions that we need to take during our pediatric visits.
Hello friends, I am Dr. Parvinder Singh Narang, Associate Director Pediatrics at Max Hospital. Today, when coronavirus infections are going and increasing day by day, we have already had more than 25 lakh cases and 1,77,000 deaths in the world. Parents, our essential measures are getting compromised, but in this video today, I will advise you how to avoid sickness during coronavirus and remain healthy. Essential measures are social distancing, good hand hygiene, and maintaining proper avoiding of infection. If you and your children remain well and maintain this distance, probably the infections will become less. But now if you become ill or your child become ill, how to go about it? So there are two ways of doing it. One is do some preventive measures at home, like if a child has fever, give him paracetamol according to his weight and give him plenty of fluids and discuss with your doctor. Discussing with your doctor is sometime only on the phone possible because social distances has to be maintained, and a video consult is quite helpful because parents are reluctant sometimes that what doctor will be able to do, but with a good history and seeing the child activeness and other parameters, he will be able to diagnose or will be able to help you whether your child needs to go to the emergency health services or remain at home and do medications. Sir, during this corona epidemic, other thing we are lacking on the immunization of the children. In last Ebola infection in 2015, soon after that there was an increase of measles, pneumonia and malaria and tuberculosis infection. Same thing can happen with these infections as well. It is very important that we continue to complete the vaccination of the children, especially in the primary series and children up to the age of 1.5 to 2. So you can visit the clinics, and with the visit to the clinic, visit when the child is well, visit only with 1 or 2 adults who are well and everybody at home is well. With this, if doctors give appointment and space the appointment that nobody else is there in the clinic during this, and the vaccination can be completed. It is very important that the primary series vaccination, DPT, Hib, hepatitis B, pneumococcal, rotavirus, measles, mumps, rubella and influenza needs to be completed in time. Multiple injections can be given at the same time, and this is possible when the child is well, and doctor will maintain the proper measures to give the injection. When you visit the clinic, wear the mask, give a good hygiene to your hands and maintain a social distance. And in the clinics, it is important we call you by one, and again wear a mask, gloves and maintain a hand hygiene. With these measures, I think it will be helpful that once the corona is over, we will not see the increase of the diseases which can happen if we miss on the vaccination. Thanks.